Tanya Williams at the Division of Child Care and Early Childhood Education. Welcome to 2022. I think I'd hoped we would have be in maybe a better situation, but I will start with this announcement. If you thought there were any delays with the Division of Child Care before, I can assure you there will be now. I am seeing numbers come in from my own team, and it is more than I've seen throughout the pandemic. So just be aware that is going to cause some delays for work here, and I really do apologize for that. I'm sad for my employees. I'm sad for their families, and gravely concerned for all of us. I don't know what is going on out in the world of early care and education right now. The numbers are really small. We have 5 closures. I'm going to go ahead and start with my updates, and Brenda will move those slides forward. We only have 5 closures that we've been notified about temporarily that affect about 225 children. So that seems pretty small. That could increase. I know we have some programs that have some classrooms that are closed. So it may be that folks are doing precautions and are able to keep their programs open. But please be aware that the numbers across the state, if you're not paying attention, are really remarkably high right now and are continuing to grow. So be safe. Consider masking, consider vaxxing. Those are not mandates, but we highly encourage that to protect children and families and the staff that we work with. So, but do be aware that we are unfortunately seeing a high volume within the Division of Child Care right now and our own agency. We have we're almost at 15,000 authorizations for essential worker families, which is really exciting. So I've had several programs reach out to me. We do have essential worker childcare funding. I've had people reach out, how long do you think that will last? I will tell you, for the month of November, we had about 5 million billed. For the month of December, which was only December 1st through the 19th, we had about 11 million billed. So you can see the numbers are changing. I think January will be very helpful in looking at a full month. As many of you know, we allow up to 60 days for billing, and I've kind of mentioned that before. That causes some problems with projections whenever people don't bill timely. And I am seeing you all bill a little more timely, and I really do appreciate that. If you're serving essential worker children, it really is helpful in terms of projections if we can get that billing in as quickly as possible. So please consider that as you're doing your voucher billing. And I see some things in the notes coming up about that. So, just be aware that I know Brandy has some announcements about essential worker families, but we are continuing to authorize families. We do have funding. We have 130 million. We've used about 16 million of that 130. So we still have over $100 million. We're going to continue to add families. There will be a point where we will start notifying, and we will announce it on this call, that we can no longer add families, and that we'll only have them for the extension of time that we can serve them based on the billing that is coming in. So we're going to try to give you ample notice and give families ample notice as we move forward. My projection is that if we make it through summer, I know 130 million sounds like a lot, but my prediction is we might get to the start of the school year. But we will continue to monitor that. And I know January billing will help immensely in terms of projections. We've utilized approximately 47 million of the American Rescue Plan Act funding. Most of that has been in the grants, both operational and quality. And then we've used right at 17 million for essential workers. I think I said 16, it's a little bit over 16 million, so I rounded it up. For the COVID relief funding received from 2021, we've utilized all but about 3 million. I'm leaving that. We have some funding for deep cleaning. I mention this every time. We are keeping that deep cleaning fund available. So we'll still have that for you because, as I said, these cases are continuing to increase, and I think you'll see them at your center. So please know you can submit if you have your building professionally cleaned, or if you have receipts for cleaning, you can submit those to the deep cleaning email address and get that covered in terms of funding. We'll pay you your program for that. We are also leaving for any remaining billing, and then we will continue to monitor that to see what, if any, is going to be left. So just be aware, we still have funding for deep cleaning and any remaining billing from last year. There is no change or update to the pandemic guidelines that are posted on our website. It is under important COVID-related information. I do encourage you to take a look at that. I encourage you to stay up to date with the Centers for Disease Control announcements. I know they're making some changes and updates. I encourage you as a business owner or as a part of a nonprofit or as a part of a school district to really pay attention to what your organization is telling you. Everyone has a slightly different approach. We don't have a one size fits all. So make sure you know what your organization requirements are. If you have the ability to influence those, make sure that you're keeping yourself and the staff and the children and families you work with safe. That's the best information I can give you. I am fully vaxxed with a booster, a mask by my side. I do not leave this office without the mask. I don't go into any public place without the mask. So don't expect to see my face except on this call. And I have told my staff we will have no in-person meetings. Everything is virtual in this agency right now. Everything in my division is virtual. We are sending staff out to do reviews. They will be wearing a KN95 mask. If you have a problem or concern about any of my staff and their masking, please let me know. We are highly encouraging to protect you and to protect them. So we've made that available for our staff. We have gloves if needed, but we are continuing. We're trying to continue our work as best we can, but we do have staff who will continue to monitor in licensing. Yes, lots of outdoor play if the weather allows, Sandra. So it's a little chilly, but yes, bundle those kiddos up and get them outside. Keep them out in the fresh air. But just wanted to just say thank you guys. We've been at this now. We're getting ready to start in on a third year, believe it or not, in a few weeks. And it seems, you want it to get better. And I believe that it will, and it is. But unfortunately, we've got a big surge right now. So just hang in there. And I'm going to move us on. We have some guest speakers today, and I'm really excited. I had to go back and look, Virginia and Amanda. But these are colleagues of mine from someone who used to work here in childcare, Tanisha Barnes. They work in behavioral health in our agency and with our agency, and they're going to be talking to us about some exciting things that they're doing. So we're going to go off track for just a few minutes, guys, and take our minds off of the COVID pandemic. But this is very good information about substance use, and I'm really excited about Dr. Virginia Stanek and Amanda Hubbard being available to talk to us. So I'm going to hand it over to them.
Thank you very much, Tonya. I'm sorry that I am a voice without a face today. I don't have a webcam on my main computer, so I'm hampered by that. And I see that even my little photograph that's usually my moniker at work is not showing up. So I apologize. I'm Virginia Stanek. I'm the project director for the State Opioid Response 2020 grant, which is primarily an opioid prevention grant, but also encompasses stimulant use prevention. And Amanda Hubbard, or Mandy, as she prefers to be called, is our state opioid prevention coordinator. And what we want to focus on to briefly speak with you today about is two things that we've been doing for a while that relate to activities that DCC, ECE, and all of you are engaged in, which is childhood overdose prevention, and in various forms. And first, I want to make you aware that a few years ago, under another grant that's now closed, we developed a curriculum for the Naptime Academy, and it was designed for voucher participants so that they could go on Naptime Academy and take a curriculum on opioids and prevention of opioid overdose or risk in their children and with themselves. And it was sort of like a basic opioid drug prevention program for the voucher participants. That's now open to anybody who wants to take it. I believe the DCC ECE staff probably has any specific information that you might need about how to access Naptime Academy material. And if you're interested in looking at that, you can contact them. There's also a curriculum that was developed side by side with that opioid prevention curriculum that's on marijuana and the effects of marijuana and marijuana prevention. So that's another good thing that you might want to look at. It may not directly affect you, but it may give you knowledge that might help you with some of your daycare kids or their parents. The other thing, and I'm going to primarily turn this over to Mandy, the other thing that we have going that DCC ECE is becoming involved in is a safe drug storage initiative where we distribute different kinds of storage containers that are combination locked so that people can store medications that may be dangerous to kids or shouldn't be accessed by anybody but the patient who's supposed to be taking them. And DCC ECE is going to start participating in this. We've already got distributions going with another division, the Division of Child and Family Services, and they distribute these safe storage containers to foster kids and the foster families. So let me turn it over to Mandy, since she's primarily the liaison for that program, and she can talk more about how to get access to these devices.
Hello, everybody. Good afternoon. Thanks for joining us here. So we work with Mid-South, and we're collaborating with DCECE, DCFS, and also Head Start. And we have lock boxes and bags. So we have a small one that will contain 3 to 4 bottles. We have a medium box. It's 4 to 5 bottles approximately. And then we have the large, which it's 10 to 12 medium bottles that it will contain. And so far they have distributed, it's 2,539 safe storage items to 10 different areas at DCFS. And what we need, if you would like to have any of those, is to select a point person for your area and send me, which I'll put it in the chat, my email, send the name, address, which model, size, and how many of each that you would like. Okay. And I think that's, yeah. And if you need the exact dimensions, I have those available as well. I know it may be kind of difficult to see exactly how big or small they are.
Does anyone have any questions?
They may type some things in the chat box. I just, I know this is a little bit of a departure, but I think it's really important, particularly in light of a pandemic and what we're seeing with child abuse and other things. We just wanted to make sure that you all were aware of this opportunity around substance use and substance use disorder, of some things that are going on in our agency that might be able to help those of us in early childhood. So I really want to thank our guest speakers. I really do appreciate you all, and we may have you guys come back. So we'll shoot an email over. If there are questions that generate from this, please check with your licensing staff. These ladies, we can contact through our office or division of behavioral health, adult and behavioral health, but they're available to work with us. And so just really appreciate the work that you all are doing to prevent children from getting into things that they shouldn't and keeping our children safe. So appreciate that. I think we're going to go into our next speaker, and it may answer some of the questions. So just bear with us. I believe that Tom's team is up, and they're going to be talking about both essential workers and childcare vouchers, as well as the grant and other things going on around the ARPA funding. So I'm going to let Tom's team take it, and hopefully that will answer some of the questions. But if not, we'll come back to them in just a moment.
So I have been seeing, I guess I'm gonna be heard. I don't know if I'm gonna be seen, but I'm seeing a lot of questions come across both on grants and vouchers. So let me first just give a general disclosure that if you have particular questions on a voucher, I put both my email and Brandy Ishmael's email in the chat. If you have a particular question on a grant, then you can email Paige Cox, and she will answer that. And Paige, if you put your email in there, but we'll be discussing all of those issues. I want to make sure I also take this opportunity to once again reiterate the deadline for Better Beginnings Level 2 and vouchers. That deadline is fastly approaching to June the 30th, 2022. If you are not at Better Beginnings Level 2 by June the 30th, 2022, you'll no longer be allowed to accept vouchers. Our federal government and the Office of Child Care has put a high importance on quality and getting CCDF children in a quality situation. So, and I know that you can reach that. We are providing all types of grants and money for you to get there. So if you have any questions on how you can get to Better Beginnings Level 2, please contact Kelly Hilburn, and she can provide you information and help you reach the goals that need to be met. Do not wait until May to try to get there, because you'll never make it by then. In fact, if you've not already started that process now, you're already late. So please get that process started immediately, and we'll appreciate that very, very much. So I have several folks that's going to be speaking to you today. I have Rachel Machen, who is going to talk to you about where we're at on our grants and give you some information. There is one concern that I have, and she'll be mentioning the exact numbers, but we have over 700 facilities across the state that's yet to even apply one time for any of this grant money that's out there that they qualify for. We have made phone calls to each facility. We have sent emails to each facility. So if you guys can help us, knock on the door of your neighbor facility, because they're leaving money on the table that is available to them to assist them in their program and help them get to the level 2 qualities, as well as operational expenses. So Rachel will be talking some about that. Following Rachel will be Paige Cox, who is really in charge of our grant program, and she will be talking to you about our expansion grants and our supply building grants and what you can expect to see from that. And then finally, Brandy Ishman, who is in charge of our voucher program, will be talking to you about our vouchers and where we're at on that. I did see that Kelly put her email in the chat box as well. Thank you, Kelly, for that. I'm going to turn it over to Rachel right now. She's going to provide you, I think, some very exciting numbers of what has been happening over the last couple of months here in the division. So Rachel, you're up.
Hi guys, so glad to see you all on this call today and get the opportunity to touch base with you all. I put some numbers up on the screen for you guys regarding the American Rescue Plan Act stabilization grant numbers. In the year of 2020, we paid out $38,985,988 between both categories. It evens out to be roughly $20 million for operational and $18 million for quality. Now you'll see here that I put 2021, $9,072,500. That is the estimated payment that we will be making tomorrow. So in total, that's $48 million that we have been able to get out to the early childhood field, which so desperately both deserves and needs this funding assistance right now. As a reminder, we make payments on approximately the 5th and the 20th of each month. And if the 5th or the 20th falls on a weekend, you can expect that payment to be made the following business day. And please allow anywhere between 10 to 14 business days once we've made that payment for it to process through all the systems that it has to go through for it to show up in your bank account or for a check to arrive at your facility. And to what Tom was talking about, 704 facilities have not in any way engaged with our system to put in an app of any kind. 953 facilities have not put in a quality improvement grant, which means there's about 250 facilities who've done an operational grant, but have not yet submitted their quality improvement grant. We're going to break down those numbers a little bit further. You'll see here app status started, the 165 and 321. What that means is that's someone who has started an application, but for some reason has not finished that application. Whether that be that they wanted to look at their budget more closely, they just had something that they needed to get, a photo ID, a certificate of authority, but they have started on it. For ARPA applications, for the first two for operational and quality improvement, it requires 2 levels of approval. Once it gets through this first review status, you'll see here that we have 28 and 69 that are needing to go through this first approval. That is kind of your baseline level of approval. That is the first person who sees your application and checks it for completeness and makes sure that nothing kind of red flags on it before it gets sent to a second reviewer. We have 9 and 16 applications waiting in the queue for second review. If we can get those approved before tomorrow, they will go out with that payment tomorrow. We do our very best to zero that queue down before we make each payment. We've been working very diligently to get these numbers as low as possible. I'm very, very proud of the team who has been approving these ARPA grant applications. They have just been working at lightning speed to try and get this money out to our field. You'll see here these needs information. If you are on that category, the chances are you have already been contacted and we have let you know what information is still needed to finish processing your application. Usually that means you haven't been set up as a vendor, or there was something on the application that we thought might have been miskeyed, or something that we needed to talk to you about just to make sure before we sent that on through that everything was how it needed to be. You'll see that we have denied a few applications. Don't worry, that is not the norm. We are going to try our very best to approve every single thing that comes through the queue if at all possible. This would be very rare scenarios, like a facility closed and is no longer in business. They made an application and for some reason something happened after the fact that's just not allowing them to be in operation anymore, or they had to change ownership, or some kind of emergency came up that just wouldn't allow DHS to be able to pay them. You'll see that we have 49 operational apps being prepared to be paid tomorrow and 119 quality improvement apps that are being prepared to be paid tomorrow. So if you see that status is approved, that means you're approved and you're in the queue about to get paid. You'll probably go over with the next payment. And then we have paid out 859 operational apps and 330 quality improvement apps since we started this grant program back in October. You'll see the number at the bottom. 1,830 facilities are currently eligible for ARPA funding. We strongly encourage you, if you have not, to get onto the website and apply. And if you have a question, please contact myself, Tom, Paige, Nicole. We will be glad to answer those questions that you may have. And I think that this is just very exciting information for our field to see that we've been able to put out this this kind of funding over the last 2 months. And with that, I will turn it back over to the next person speaking. Unless you guys have any questions, I'll be happy to answer.
Rachel, as we're transitioning, I just want to jump in. I want to be really clear. When we talk about making payments, we actually don't make payments here. We send it over to the Department of
Yes.
Finance Administration. So when we're talking about processing time, and I know a couple of people have asked that question before, we are submitting it over to the Department of Finance Administration, and then they will run it through the process that they use, which is, you have to be a state vendor, your banking account information, your bank routing information, all of those things are part of the processing time. So just be aware of that. We do not make it. When we say the 5th, that means we are sending it over for processing for the payment. Don't expect the payment on the 5th or even the next day. It usually requires a little bit of processing time over at the Department of Finance Administration. So just wanted to clarify. Thanks, Rachel.
I did real quick get a question on the time frames to spend the money. We have until September 2022 to actually get this money out to you guys. And then from there, you guys have until September 2023 to actually obligate and expend the grant that you've been awarded.
Okay, well, I think I'm up next. Thanks, Rachel. I did want to say that although you might have noticed that we used the dates of 2020 and 2021, Rachel, in our payments, I think it's just because I know Rachel feels the same way I do. Time is not changing. Here we are. We're still in our Zoom world, but no, I just thought that was funny because that's like something I would do, Rachel, and you would catch that. But anyway, funding is still available. We'll be making a payment now in 2022. And on top of that, there are more opportunities for you guys to apply to provide quality care in your community. So the next grant that will be open and available for everyone is the Child Care Expansion Grant. Now, this one is a little bit different than the others. It's different than the operational and quality in that there is a more limited or finite amount of funding available. So where we've been telling you all, no worries, no hurry on the operational and quality, the expansion is a completely different story. And as a matter of fact, because it will be a little more competitive and there's a smaller pot of funds, we'll be handling this one differently than the others in our processing as well. So what we're intending on doing is we're hoping to have the grant open in January, mid to late January. And the grant will only be open for, we're still determining it'll be either 30 to 45 days. Once we make that decision, we'll definitely be messaging it out to you all, but we have to have it open for only a certain amount of time because we will be prioritizing the applications that we receive to determine who has the biggest need and is the best fit. So for the expansion funds, this is to really increase the availability and supply of quality care for services for infants and toddlers and school age in the childcare deserts around the state. So we have identified areas, and you guys know, out in the field where the needs are. And we're hoping that you will grasp onto this opportunity and this funding and take it as like, take the reins and move forward to continue serving kiddos in your area. So there's, we're looking at the priority areas. With the expansion funding, the way that it is similar to the quality and operational is providers still have to have been licensed on or before March 11th, 2021. So that's the same. The eligibility is the same. It's just that you really need to identify the need in your area. So we want you to think about your community and have data. We're actually going to be asking you on the application to fill out, I know, like instead of just putting numbers, we're going to actually ask you to complete maybe a short narrative explaining why you need the funding in your area. Like, do you have a waiting list? Is there a new business in the community? Do you need non-traditional hours for parents? So just be thinking about it. And also keep in mind that the funding is really, this particular batch of funds is not for pre-K. It's really focused on infant, toddlers, and school age populations. We are encouraging you, like I've said before, is to talk to the businesses or think about the needs in your area and see if you can partner if they have a need for services. And the funding, there is, I think there's been some confusion between this grant and then another one that we've discussed, which is supply building. So this is expansion. It's really you've got an existing facility, you're wanting to open up new classrooms. The funding really supports, like, it's almost like, I would say, a classroom in a box, like all purchasing everything you would need, all the supplies and everything to set up the classroom. And then it can be used to pay or help pay the salary of the staff person. But it's not like with, the amount's not as high as you've grown accustomed to seeing if you've applied for quality funds. So that's just something to be thinking about. You'd be thinking about, this can't be the only source of funding for that expansion. You need to think about other ways that you can continue moving forward. The supply building, the difference with supply building is that it is also going to be competitive, but it will not be run through the application system. Because in order to enter that application system, you have to meet that first criteria, which is you have to have been in business on or before March 11th. So the supply building grant will be competitive, and it'll be outside of the system, and it will be more traditional. When I think of like a traditional grant application, that's what it will be, more along those lines. It will require you to partner and really work with your community. And the funding is actually to establish, you could establish a center with the supply building funds. It doesn't have to, you don't have to. You could still look at the supply building in terms of setting up new classrooms, but you've got more opportunities. You could actually consider opening up a new facility. So that's a little bit of the difference between the two. Okay, and someone just asked me about establish a new facility. Okay, when I say small amounts, I guess I'm thinking in terms of, I've been looking at the quality. Some of the quality grants that have come through have been several $100,000. And whereas okay, excellent question. Small amount is relevant. Okay. My interpretation of small amount and yours could be totally different. For me right now, I can tell you that $50 seems like a windfall. I mean, when I have a bill that needs to be paid, any amount is great to me. And I typically have bills. So I appreciate you asking that question. Now I was gonna pull up, let's see. Okay, here's the difference. So, and I don't know that I have time to share my screen, but if you have specific questions, I'll just give you like kind of a brief overview. For expansion, for example, if you wanted to add 5 infants, the subgrant award would be $15,000. If you wanted to add 15 infants, it's $45,000. Yes, that's a lot of money, But when I've seen some of these applications that have come through that have, I just want to, okay, sorry, I was getting another message. So something, anyway, I just wanted to make sure that people like me, for example, or you weren't thinking, oh, this is going to be enough to build a new facility. It can't be used. That's another thing. It cannot be used for major construction. That's not the intent behind these funds. So I hope that answers that. And I know that Nicole, and I think we've dropped my email in there several times. And we'll catch, let me see if I see, I think, let's see, the difference between, missed the difference in this last grant. I was muted in the beginning. Okay. I'm not sure what difference I was talking, I'm not sure what you missed from what I was saying. Oh, I kept breaking up. Gosh, guys, you just missed such an excellent presentation. I'm sorry you didn't hear all of it. My contact information will be on the side. I think that several people are behind or after me, and I'm happy to talk to you all. I will just say, if you want to talk to me, please call me today. My grandson, I'm going to be able to see, will be in town tomorrow. So tomorrow is like Christmas or about my holiday break to me. So call me this afternoon, and then I'll be back next week. Oh, I've been asked to please mention that this is totally off topic, guys. The Outstanding Early Childhood Professional of the Year Award nominees are due January 21st. So there you have it. Thanks, guys.
Okay, well, it looks like I'm up now to talk about essential workers. I want to start out by really giving a lot of kudos to our team here in the Family Support Unit. This month alone, well, not this month, I'm sorry, December alone, our team completed 6,210 authorizations, and most of those were for our essential worker families. We do have a significant amount of families who have not submitted a reevaluation to us. So we've nearly completed everything that we have received. But when I say a significant amount that has not turned anything into us, that's over 900 families that have not turned anything into us. So if you have a family who's been contacted, say, for additional information, or they have been notified that they qualify for the low income program, those families have to get that information turned back into us. We will not keep those cases in essential worker. As you know, we sent out messaging to you all that we changed our funding stream, and we needed any family who was eligible for our low income program had to be transitioned to that low income program. So those families, when they were sent that information, they are required to get that back into us. When they get that back into us, we will make those necessary corrections to their vouchers. Now, if they do not return it by the due date on that low income notice of action, that case will close. So please speak to your families and get that information from them. It is sent to them via email. You will also be able to see that in your billing portal. Whenever a case closes, you will see that information immediately. When they receive the notice of action from our team members, please have them to make sure that they return it to that specific team member who the notice of action came from. Do not return it to the redetermination email box. It needs to go back to the person who was working that case, and that is who sent it to them. All their contact information will be in the email that they received from that team member. I want to let you all know, as we talked about, that we still have over 900 that we have not gotten anything back from. We are looking to begin our case closures Monday. That is January 10th, 2022. So that is Monday. We're going to go through and we're going to close all of those cases who have not returned anything to us. Keep in mind that we sent out the request for the redetermination packets back in September. They were actually due to be submitted into our office by October 1st. It is now January, and some people still have not returned anything to us. So we are currently scheduled to begin those case closures on Monday. If anyone has not, the people who have not submitted anything back to us, they do not have an authorization at this time. Okay, so anything that has a notice of action out on it, say it's someone who just went ahead and submitted their redetermination packet to us now, and we need something back from them, those notice of action dates will be a little bit later. So they still will not have an authorization until we get the information we need back from them, but their cases may not close on the 10th. It may be a little bit later. So please encourage your families that if they have received anything from us, to please get that back into us as soon as possible. I want to let you know that some of the cases that close, say we have people who don't turn anything into us at all and say till February, till March, or we look in the system and we notice that no one was billing on their authorization anyway. Those cases may be required to submit a new application to us. So we're going to look at all those on a case-by-case basis. I would encourage you to just have your families make sure that they have turned in their information to us. Anyone who you do not have a current authorization for, I want to encourage all of you to begin expecting payments from those families. We cannot make you any guarantees that these families are going to submit their information back to us. We have sent out information requesting it. In some cases, we've sent a second, third notice, and some people just are not responding. So we cannot make you any guarantees in that regard. So if you have families currently who do not have an authorization, we encourage you to ensure that those families are making payments at this time. I think that one question that I did see in the chat was about people still wanting to apply for essential worker. I know that Tanya addressed that earlier on. We are still accepting applications and we will work those as they are received. So if you have new families who are essential workers and they are in need of childcare assistance, please have them to apply. I'll turn it back over to you.
I noticed that Brandy, that we're getting several comments in the box. I will say a couple things quickly. We send emails to the addresses that were provided to us in the application. Often we have found that people change their email addresses and do not contact us. And then we have no way of contacting them because all of our correspondence goes through email to these clients. So if they've changed email address, they certainly need to contact the division and update their email address with us. Someone asked which essential workers received a reevaluation. Every single essential worker had to be reevaluated from the month of October on. The law changed when they passed the ARPA Act, and we have to require additional information from every single essential worker. So if you've got an essential worker, then they have received an email through the email. This is all through our system on the email that they have provided to us, and for additional information that they have to provide. So 2 important points that Brandy has said. We are still working on trying to get everybody approved that we can. You need to understand, it's not our goal to deny anyone. It's our goal to approve them. So if we can get the information, we will approve them. And the second thing is, if they have not been approved, we can't guarantee approval for anybody until you've got an authorization. So you might want to consider collecting money from them until their authorizations are approved. That's the best that we can do on that, because I cannot make a blanket approval that everybody's going to be approved. If you have particular questions about particular cases, I've already put in the email at my email address and Brandy's email address in the chat. You can send those directly to us and we'll be addressing those as they come in. Tanya, I think that's all that we have at this time.
Right, I'm gonna start going back up to the top, but hang on, I'm gonna make sure we've got everyone covered. I just want to there's a lot of questions today. So I know Kayla has put in, Brenda's gonna share the slide. I don't know if Kayla has anything she needs to share, but the next regulatory check training is January 27th from 12 to 1. So for anybody who needs training on the new automated system that went into effect actually over a year ago, Kayla's team continues to do monthly training, and we encourage you to do that if you have new staff or if you have somebody that maybe having some difficulty with that. I'm going back to the questions though for a moment. So I saw one, and I may ask on my good friend and colleague, Sandra Withers. There was a question, I think it's from Jennifer Easley, but Jennifer, I may be wrong. It may have been from someone else. But it's a very good question. And I know we've had some of that here in our office about you have been exposed and you're advised to quarantine. The health department is calling and saying 10 days. The website says something different. I'm just going to tell you what I would do. If I was told to quarantine for 10 days, I would quarantine for 10 days. Sandra, is there any advisement as a health professional that you'd like to throw in there? I don't know if we can unmute Sandra, but if not, please feel free to type it in the chat box, Sandra. But I would follow the verbal direction that the health department is getting. There she is.
Okay, I think I'm unmuted now. Yes, I would follow the guidelines, that the instructions that you have been given. They have had that. It's confusing. It's confusing even for those of us in healthcare. But there, even with the 5-day return, that still means even if you got that, you still would not be able to come back if you still had significant symptoms. And what I'm hearing from people is most of the time at 5 days, they still have symptoms. So there is that. The exposure, again, I would follow the guidelines that you're getting. 10 days is much safer.
I mean, there's some discretion there for you all. There isn't any mandate from us, unless the health department's giving you something. I would advise you to follow that. But if you have discretion and you're not being told, then, you have to make the best decision. I think what we're saying is better to be safe. And I will tell you, as someone who's watching numbers grow here, some of it I'm seeing has to do with people coming in, getting tested negative, and then it turns into a positive within a day or two. So just
a reminder that even when you come back, you have to mask. You have to mask to be safe.
Okay, so I'm going to there was some great questions and comments about storm shelters. I'm going to touch on that for just a moment. I think staff have responded. We've had some questions, but I want everybody to hear this because in light of what's been happening across this country and in our own state, I think it'd be a great opportunity for you to be aware of this. We had some family child care providers specifically reach out to us about potentially using some of the funding for storm shelters, because there are prohibitions about building. But the way I read these was it was a prefabricated sort of thing. I said we should ask our federal partners before we say yes or no to that. I'm kind of a safety person and I like to mitigate risk. So I felt like it was really prudent to ask and not just go forward with a no or a yes, and make sure that we're doing what is expected of us with all of this money. We are very hopeful that it will be a yes from our partners, but we have not heard from them. But for anybody, I think Ms. Jackson, was like, what's the storm shelter thing? It would be a prefabricated type structure, which we have those agencies, companies, organizations that sell those in the state. But it's certainly something for those of you who are maybe not sure, maybe you've meeting the quality marks or you don't have a big checklist of things, I would certainly encourage you to consider it in light of the tornadoes that we've had that have proven to be very deadly. And we just don't have any way to predict that. So if it's something you're interested in, certainly we will keep you apprised as we get notice from our federal Office of Child Care. They are researching that. I wish I could tell you a deadline or timeline. They gave us $500 million. I don't feel the need to pressure them with an answer. We can certainly reach out to them again and ask, like, hey, any news on that? But I know they are working it through the process through our regional office up to the federal office in DC. And we expect, that we will get an answer very quickly. They're usually very quick to respond. I think the holiday probably, will create a little bit of delay, but probably within the next week or two, we'll get an answer from them. So again, for anybody interested in storm shelters, we are trying to get an answer on those that are prefabricated. If you're interested in using some of the money for the American Rescue Plan Act. I know we spent a lot of time on essential worker vouchers and low income vouchers. I think Brandy did a wonderful job trying to explain all of that. We are continuing to process applications. Certainly the applications, the families that we're currently serving are a priority. However, please note that if we do not have complete applications, in other words, if we do not have all the information, we cannot process it. It would be an audit issue on our side. So we have to have all of the information from families. It's possible because of the new requirements of the sort of certification that you do not have assets that equal $1 million or exceed $1 million, or the check stubs to make sure that you're not eligible for regular low income, that those are the items that might be missing. But please note, if you are looking in your system at the families that are on vouchers and you have families that you're serving and they are currently not authorized, it is very likely or possible that they have not submitted information back. Please feel free to say, hey, I noticed this, reach out, let me help you reach out. And Tom and several of the staff have put in their email contacts. And I know every day I see those coming through, and every day I see many of them being taken care of very quickly. It's just there's a large volume, and if there's somebody specific and we know who it is, we certainly can look at it. But I know the families are busy. I do think the email thing is probably a challenge. I don't know how many people check their emails. Maybe that they work like me. I don't look at my personal email account all the time. Maybe that's part of the problem. Maybe the way they wrote it wasn't really neat and we may not have it right. Maybe they've changed it and we have the wrong one, but we are requesting the information back through the email that was provided by them. So if you can see in the system, or if you know you have families that aren't currently authorized, and I know people are doing it because I'm getting calls from the families. My provider told me I don't have an authorization. So you all have the ability to help influence your families to get that information in. And we want to get them reauthorized. We want to get them taken care of. So please help all of them, essential workers and low income, get that in so that we do not have to close those out and they have to resubmit. Mary Beth Shields, thank you for the idea on the one pager. I did post the one pager that we do have. Yours might have a little more information, and we can certainly take that to our comms folks and just build out for the 3 grants. The one that I put in there is about the total American Rescue Plan Act package. It is a one pager though. So that one might be helpful, but we'll certainly talk to our comms folks and maybe try to get something a little specific about the 3 grants. I do want to talk about the expansion grant. There are 2 different things that Paige talked about. They're both about expanding opportunities. The first one is about expansion for providers that are in place today and that were licensed on or before March 11th. That is a distinction. In the second part of that was on her slide about the supply building. The supply building is for brand new, never been licensed programs. So just to make that distinction for you all who were paying attention to that. The expansion grants, are for all of our over 1,800 providers that were in place prior to March 11th. It might be adding one classroom or, just a few children to a home or something. But please work with your licensing staff. I have seen the staff have worked on a very abbreviated application, and I'm very grateful to them for that, for our providers, so that we do not overwhelm you with the expansion. The supply building, however, will be for those of you who have done a federal Head Start grant or an ABC grant. It will be as simple as we can make it, but more in line with that as a competitive application. And it will have some additional requirements. It's really about working with your essential workforce in your community. Think hospitals, doctors' offices, manufacturing companies, school districts, colleges. Think about all the grocery stores, people that had to be open and go to work and do things. Could be the health department, could be Department of Human Services in your community. Think about those folks who had to keep working. How could you help supply childcare to those folks if there's a need in that community? If it's all taken care of, may not be a need to expand, but we know there are places where there is a need. So think about partnering so that you don't build something and there's nobody to come to it. You want to make sure you have people who are going to come. You also want to make sure that you mix it with people who can pay, not just people that we're paying for at the state. So be very thoughtful about that and very intentional so that you'll have a good financial plan at the end of the day that will sustain you as we move forward. So just wanted to make that distinction. I see a few suggestions in there, so appreciate you all for that. I won't address each one of those. For those of you who are sending in some very specific things, please reach out to those email addresses that have been put in. Carolyn Robinson, I see yours and a few others. If you've got some specific families, please reach out to the team and we will try to work with you to address whatever we are missing for those families. I have seen a couple about closures that closed. Brandy, do you want to reiterate anything on those? It says that some of those received closure for 12/17 and it actually closed on 12/7. I don't know how to make sense of that, so I'm going to let you, we may need to look at that specifically. That could be an error, it could be a problem, but that doesn't make sense to me. But if you are familiar with any that were closed or why they might have been closed, I did hear Brandy say something about we had some that were not being billed on. So any comments there, Brandy, that might help clarify?
Yeah, as you said, there's a multitude of reasons that could happen, but if you want to reach out to me with that specific case, I can dig into it to see what happened there.
Okay, let's see. Looks like most of these are about essential worker vouchers. I had a question about how long does it take? I think Brandy kind of gave you some data at the beginning of her presentation. They authorized 6,000 families. Those were all renewals in December. And that's probably half. I think I mentioned at the beginning that we have about almost 15,000 authorizations total just for essential workers. That is not our regular low income childcare and ESS cases and foster care. That is just essential worker cases. So it is a very large volume. We do have some extra staff who've been with us now for a couple of months. I think folks are trained. So I think we're making good progress, but if you have families, either low income or essential workers, please reach out to the staff and we'll see how we can assist you. If you have foster care families, you can reach out to us. Those actually come through DCFS. If you know it's a foster child, those referrals come through DCFS for us to authorize, but we cannot make that call without their permission. I think what I would say, without getting into very many specifics on the essential workers, when I submit an application for something, in order for it to be approved, everything has to be with it. So for me, when I think about an application, it is a complete application. If it's for low income, it has to have check steps. It has to have a whole list of things. If it's for essential worker, we have to establish that they do not make more than $1 million. That's on the application for new applicants. We have to establish that their child is within the age range. There's several criteria. So please note that nobody's trying to make it difficult for the families. And I know the families, I know we're all kind of in this triangle. They're telling you that they've submitted, and maybe they have, and maybe it's gone to the wrong email. Maybe it's going to someone and it should be going to a broad email, but there's probably some communication issue. Work with us and we will try to help you. That is our goal here. It is not to make this difficult. We've keyed almost 15,000 additional families. We want to help everybody. I will say to you all, though, that money will go and it's going to be gone. And then we won't have this conversation anymore about the essential workers. It'll be done. And it will probably be done by the time school starts, just so you all have a sense. I will keep reporting each month as we meet so that you all can get a sense of financially where we are. We will start to see at the end of January, as we see billing coming through, how much that 130 million that's already minus almost 17 million. So we're already going down. So if I just said it was 10 million a month, that means we'd have 13 months. We did 11 million last month in a short month. So I don't see it going for 13 months. I think it'll be probably around August. So we want to make sure this time that we are all talking about the time frame and that the families know, so that you all know. I got to start telling my families they need to start getting ready to pay next week or next month. So we want to have lots of time for everybody. So just know I'm going to spend a lot of time on this on every call going forward to report the money amounts that are coming out and the projections as we see it. It will change because if we keep adding, then more and more is going to get used, and it will keep getting smaller in terms of how far out it will go. It's kind of simple math when you think about it that way. I know other folks are probably typing things in. Is there anything? I know there's some questions about audit. Tom is we're going to invite our folks here in our agency to come to our next call so that you can meet them and they can talk to you. I don't know who it was that put in they were ready. Whoever you are, I love you for that. I too love the auditors coming. We want to know what we're doing well. So hats off to you who kept the receipts and are ready for that first audit. That's exactly the way to be. It's really about good bookkeeping and documentation, and that's most important. So we'll have them on next month and let them talk with you and give some timelines. The best thing I can do is tell you, be prepared for that. Just keep all of your, keep good records. Get you a folder and just keep your records. Try to keep them organized in a fashion, either by month, by date, chronologically, however you do it, but just keep good records. Please don't hand it to us in a trash bag. That has happened before and it's most frustrating. I do want to talk, Tom, if we could for just a second on the expansion versus supply building. So expansion for programs that have been licensed, because this can get a little confusing and I see some good questions about this. So if you had a licensed facility on Main Street and you've opened up a new facility on Jones Street, do you fit into the expansion because you had a licensed facility, but your new one is new? We can get real technical about this, guys. I don't want it to be that technical. We can try to keep it simple, but Tom, what are your thoughts at this point? We're just having a conversation, gang. We're just having a conversation here, but Tom and them have been thinking through these types of things. So and we also have to be true to the federal requirement. So what are you guys thinking about for expansion for new programs? Or for existing programs, sorry, for those that were licensed? Does the supply building go to brand new only? And if the license is brand new? Okay, so if you're licensed today and you were licensed March 11th, then in that building, we're thinking in the building that you're in, not a new building, in the building that you're in, you would be expanding. If you have a new, brand new, newly licensed space, then you would be eligible for the supply building, correct? And that can be even post. If it's between March 11th, it's after the March 11th date. Am I wrong on that, Tom?
So if you're a facility, then you already have been in business on the March 11th date, and you're wanting to work with a facility or a business across town and open a new campus is what we're calling it. I know it's a new facility because you get a new license number and everything, but since you are in business, you can use our expansion funds for that. Now, the problem you're going to have with those expansion funds is they're not going to cover all those costs for that. At $15,000 for 5 kids or $30,000 for 10 kids, and then a $15,000 stipend for a teacher in that classroom, that's not going to cover the cost of expanding into a new facility. And that's the money that we have. That's the funds that we have. So that'd be the limitations in starting a brand new facility. You could use part of that money for that if you are already licensed to supplement starting that facility, but it's not going to, if the funds are not going to be sufficient for you to totally fund that startup cost of that facility. They're just not there. Could you also apply for supply building? I assume that you could. You'd have to go through that longer grant process with that. That is going to be a competitive process in which we compare all of the different grants together and see what best meets the needs of our communities. But in the supply building, you do not have to be in business at all when you apply, but you have to provide us a pretty good business plan and some guarantees. And both of these come with guarantees that you're going to keep those facilities, whatever you use the money for, open for a minimum of 2 years. So if you start a new classroom, you're going to keep that open for 2 years. You start a new facilities, a minimum of 2 years, that facility has to stay in your ownership, and it has to stay open and running in childcare. So I don't know if I explained that clearly enough, but there are 2 different options. One, with the supply building, the funds will probably be greater, but the paperwork is much greater. And you are then competing with anyone else who is also applying for those funds. In the expansion grant, for those who are already licensed, there is some competition, but is not as much competition as it would be on the supply building. And I hope I answered that succinctly. Paige, if I missed something, holler at me, let me know.
Thanks, Tom. I appreciate you for doing that. So, please know that Paige announced that expansion, so expansion for programs that were licensed on or before, will be released. Are you guys releasing the supply building at the same time, or will that come later? It'll come later.
I'm just a
So
little bit
only
late.
expansion. So we're taking care of the existing community first. So, just be ready. That will be later in January, but before our next call, you will likely see that application out there. I want to go back. I did have, and it was really to me, and I'm not going to say the name, but thank you for asking about the last maintenance payment or a final maintenance payment. We had talked originally about 4 maintenance payments, but here's what happened. The essential worker billing, and I mentioned this on the last, actually the last 2 calls, we had billing that did not come in. And so I was looking at it, wanted to be able to do that. And Tom said, we ran reports and we had so much outstanding essential worker billing. It was like 7 to 9 million. And so that's why we didn't have any money left in the CURSA funding. The amount that it would have taken to pay all of you, that was around 7.5 million. And we only have 3 million left after all the essential worker billing came in. So that's why we were not, but please note that we also had the operations grants and quality grants rolling at the same time. So it all kind of, works itself out. But I apologize. I had hoped we'd be able to do that, but because we had so many essential worker families, that's why I'm going to keep emphasizing the essential worker family piece and the projections. You all have got to hear and pay attention and listen. We will be sending out alerts and notifications, but we will not be going past a certain point this time. So they're going to get frustrated and you're going to get frustrated, but I am telling you right now, I will not go past a certain point because we are not going to get over the top and then not have enough money to pay for them. We don't have any other funding source that will pay for those families. They are over the income for childcare. So we will be carefully monitoring. We've learned a lot in the first 2 funding sources for essential workers, and we have to manage it very, very tightly and carefully. So I will mention and reiterate that over and over. And please let your families know, we're thankful to serve them, but these are families that typically pay. I'm not saying they should, we have the money, but it's not going to be forever. It is really a limited amount, and it will go, it is, as you all have seen, it has gone quickly in the past 2 years. This will too, even though it's a bigger amount, it will go quickly. Sandra, there are folks asking if you can answer questions about the Arkansas Academy of Pediatrics recommendations from yesterday. Cheryl, I haven't even seen them, to be fair, but Sandra, I think here's what I'd like to propose, and I know you'd like answers today. I would like to propose that we have an opportunity to ask either Sandra or Dr. Tumlinson to come next month and respond to that. If you are concerned about something and you want to work with our licensing team in the interim because you're worried, again, not having seen those, I don't know if it's about vaccines or recommendations about masking, but you know, we're certainly willing to work with you on the interim, but I'd like to have somebody with some expertise come to our next call, maybe somebody from the chapter here in Arkansas to really address that and talk about it. So if that's okay, we'll move past that, as I saw Sandra's nod too. She's okay with not talking about it. Okay, I think we are definitely over the hour, but I'm thankful for all of you who are willing to stay on. I know we've lost a few folks. The next call, as Brenda's reminding us, is on February 1st, and it will get here quickly, gang. Please stay safe. I cannot stress to you how I have not really been, I've been pretty calm throughout this, but I have to say I'm a little disarmed right now with all the numbers in my division. I've never seen anything like it so far throughout this whole pandemic, gang. It is, I cannot stress the seriousness. Please, please stay safe and take care of yourselves and be well so that we can see you on the next call. So take care of yourselves, and we'll see you next time. If you need us, you've got email addresses. I think you have mine. Please reach out to us and we'll try to help you. Take care.